impression is mild anterior uveitis bilaterally occurring in middle-aged patient, could be idiopathic uveitis, the first impression, but the patient is already on potent steroid for 1 week with no improvement. When I took the history, she said, I'm on potent steroid for 1 week, prescribed in the emergency department in the same hospital, with no improvement. On the contrary, there's a deterioration in vision. While preparing the patient for a dilated fundus exam, she declared a more dramatic past history. She had sleeve gastrectomy before 1 year, complicated after a few months, resulting in peritonitis, pleuritis, sepsis, and lung abscess, requiring hospital admission for many weeks with chest tubes to drain the accumulating abscess with potent antibiotic cover. Then the patient discharged home with good health, but then her eye problem evolved. The pupil is well dilated. The view of the left fundus is this view, with this lesion in the periphery of the left eye. Bilateral vitritis, mild in the right eye, with multiply fluffy cotton balls floating in the vitreous in the left eye, with overlying severe vitritis. The view previously, from the aforementioned story, the most probable diagnosis is endogenous fungal endophthalmitis. And the differential diagnosis of the causative fungi, the most common is the Candida, and others Aspergillus or coccidomycosis. The diagnosis is made clinically by history and the fundoscopic appearance, but it can be confirmed by isolating the organism from blood, vitreous, or aqueous fluid. Histologically, the Candida species are recognized as budding yeast with a characteristic pseudohypha appearance. The treatment of such cases, intravitreal amphotericin B, if with systemic infection to intravenous amphotericin in addition to the local therapy. Oral fluconazole is another good choice with good ocular penetration. The pars plana vitrectomy for severe unresponsive cases to provide culture specimen or reduce fungal and antigen load, facilitate the therapeutic antigen penetration, and to clear the media opacity. The predisposing conditions associated with candidemia and the development of intraocular infection include hospitalization. These factors should be always borne in mind in such cases to the importance of the past history of the patient, complaining from blurred vision with the clear or apparently clear anterior ocular media. So the factors: hospitalization with the history of recent major gastrointestinal surgery, bacterial sepsis, systemic antibiotic use, indwelling catheter, hyperelimination, debilitating disease such as diabetes mellitus, prolonged neutropenia, or combination of these factors. The prognosis is usually poor due to delayed diagnosis, which is mostly occurred because this is always not borne in mind, treated as simple uveitis, especially if the anterior segment is mildly involved with steroid use, which worsen the clinical picture. It's good to remember the history is vital. Listen to your patient before looking to his eyes. Patient with Patient with endogenous endophthalmitis due to indolent microorganism like fungi is usually in good general health. Masquerade syndrome, in the contrary to those with viral or bacterial infection. And thank you for listening. That's it. Here, how you know? Thank you.